This is a webinar recording for the Disaster Distress Helpline Affected Area Center Training and Technical Assistance Initiative. The Disaster Distress Helpline, or DDH, is a sub-network of the National Suicide Prevention Lifeline and administered by the not-for-profit Vibrant Emotional Health, with funding from the U.S. Substance Abuse and Mental Health Services Administration. SAMHSA and Vibrant partnered to create the DDH in 2012 to ensure that everyone in the United States and its territories would have access to immediate crisis counseling and emotional support throughout any phase of a natural or human-caused disaster. DDH calls to 1-800-985-5990 and text TALK WITH US to 66746 are answered 24/7 by trained counselors who provide psychological first aid, explore healthy coping and social supports, and provide referrals to local behavioral health resources for disaster survivors and responders for follow-up care and support. To learn more about the DDH, visit disasterdistress.samhsa.gov, like us on Facebook at Distress Helpline, or follow us on Twitter at DistressLine. Vibrant Emotional Health launched the DDH Affected Area Center Training and Technical Assistance Initiative in the summer of 2017 to support Lifeline Network crisis centers located in or serving disaster-impacted areas. The initiative includes 4 areas of focus: access to evidence-informed training in disaster behavioral health, assistance with outreach to local, state, and regional stakeholders in disaster preparedness, response, and recovery, support for disaster-related communications on agencies' social media and websites, press releases, and with other creative communications for engaging local disaster survivor, responder, and provider communities. And finally, the initiative also supports resources in crisis center continuity of operations planning so that crisis centers can develop and adapt their COOPs based on lessons learned from the disaster they experienced. This webinar focuses on outreach and will provide ideas and resources for what community-based outreach can look like for your affected area crisis center as you continue or start to engage with your community, state, and/or region during the recovery from a disaster or other traumatic event. Just like the other activities supported under the DDH AAC initiative, outreach conducted by your crisis center in relation to the disaster that affected the communities you serve should occur throughout the disaster cycle. During the preparedness phase, or what is often referred to among disaster relief providers as a period of blue skies, outreach is about relationship building and networking, increasing the visibility of your center in your community as a go-to resource for when disasters occur. Through outreach and engagement with local stakeholders during blue skies, your center can also gain access to resources in continuity of operations planning, participate in local tabletop preparedness exercises, or full emergency drills, which will enhance your center's readiness capabilities for responding to disasters when they occur. During the response phase, which includes mobilizing staff and other agency resources immediately before, during, and after disaster events, outreach involves promoting your agency's crisis and emotional support resources to stakeholders and the community at large, coordinating response efforts with other local providers, and continuously assessing the situation as it unfolds to identify unmet needs and challenges and respond accordingly. The recovery phase of disasters varies event to event, and typically emergency managers and local providers work together to determine when a disaster has transitioned from response and short-term recovery to long-term recovery. This could be weeks after a disaster or months. Recovery also varies in terms of how long it lasts and the extent of long-term recovery resources needed, neighborhood to neighborhood, family to family, person to person. Outreach during recovery looks a lot like outreach during the other phases, the primary difference for crisis centers being that your center typically is one of the resources that is in a community permanently. However, this doesn't mean that your center can just assume that services will be business as usual. Regardless of whether you have specific services that have sprung up focused on long-term recovery in your community or not, affected area crisis centers should stay actively engaged with stakeholders during long-term recovery so that mental health and emotional support remains a focus of service coordination, unmet needs continue to be identified and addressed, etc. Another benefit of outreach throughout all phases of the disaster cycle, similar to access to crisis center continuity of operations planning that I mentioned before, is learning about available resources that can benefit your staff in terms of workforce wellness throughout all phases. Especially important to consider when a disaster has occurred or is occurring in your own backyard, and so staff may be personally impacted by the disaster event. Let's summarize and talk about a few additional activities your center can engage in during all disaster phases. During preparedness, or blue skies, your center should be identifying and connecting with local, regional, such as a multi-county region your center may be serving, as well as with statewide stakeholders in disaster preparedness, response, and recovery, including community organizations active in disaster or voluntary organizations active in disaster chapters, which are two of the most effective and efficient groups for this type of outreach. We'll be talking more about specific types of stakeholders that your center would benefit from engaging in outreach with in upcoming slides. Your center should also be looking for conferences to send staff to during preparedness phase, which can include national disaster-related conferences occurring in your state or region, but of course more importantly are those conferences, trainings, meetings, and other events that are local or statewide in scope, as these will be the events where you can maximize networking opportunities with other providers located in or serving your community, and you can sponsor an exhibit table, host a workshop on your crisis center's services, etc. Participating in community events is another way for your center to promote itself as a resource in disaster behavioral health, and we'll also be giving you some ideas for those types of activities in an upcoming slide. And as we mentioned before, your center can participate in tabletop style exercises, which are essentially meetings where people sit around and discuss what they would do during an active disaster response and during recovery, as well as disaster drills, which are typically more disaster simulation type exercises where participants are fully engaged in what a disaster response might look like from start to finish. And during the preparedness phase, it's important for your center to incorporate community resources that you're learning about and that you're connecting with into your center's database so that they're ready for pulling up for assisting callers and other crisis contacts when a disaster actually occurs. During the response phase, outreach for your crisis center will primarily consist of actively participating in coordination calls and meetings, which may be sponsored by your local COAD or VOAD, or emergency management, or any other group that's involved in the active response to the disaster that's impacting any of the communities your center serves. During these calls and meetings, it's important for a designated representative from your agency, ideally the same person who had been conducting outreach with stakeholders in Blue Skies, to promote your crisis center services, including helping to identify and respond to any unmet needs there are related to behavioral health. Offer to send follow-up information to participants on the call, or encourage them to connect with your agency's official social media accounts for updates. Promote any multilingual services your center offers, services for specialized populations, such as people living with mental illness. Promote whether your center serves a specific city, county, region, or the entire state, etc. During the response phase, emotional care and mental health can be sometimes overlooked during active coordination, and so this phase is your chance to advocate in that area, share your center's resources, and hear from others what they're seeing in the field to help your center staff up and adapt in other ways as the situation unfolds. And finally, during the recovery phase, which as mentioned previously might begin days, weeks, or even months after a disaster, depending on the nature, size, and scope of the event, outreach might consist of participating in what are commonly called hot watch debriefings, sponsored by your COAD, VOAD, or other entity that has a responsibility in evaluating all of the essential components of the disaster response, which includes disaster emotional care and mental health, which your center provides. Outreach during recovery can also uncover funding opportunities that might be available to your center through special community foundation grants set up in response to the disaster, FEMA crisis counseling program grants set up through the state, etc. And outreach during recovery will also be crucial for connecting with long-term recovery groups, which may be sponsored via your local COAD or VOAD in the form of a committee and present opportunities for key stakeholders to come together to discuss ongoing disaster case management, rebuilding, etc., all of which will involve the need to continue to promote the availability of your center's services, including any new programs that may have operationalized after the disaster, or just the ongoing availability of your center's regular year-round support services. The goal of long-term recovery, much like the other phases, is to stay involved in the community of recovery specific to a major disaster for survivors and responders, even if this goes on for years, while at the same time beginning the cycle of outreach again under the Blue Sky activities. The goal of your center's outreach during each phase are the same as the 4 C's of the VOAD movement: coordination, communication, collaboration, and cooperation. By engaging in these activities during all disaster phases, using the DDH AAC initiative as a launch pad, your center can sustain and enhance its presence as a vital resource in disaster emotional care and mental health. As mentioned previously, one of the key outreach activities your center can engage in during the preparedness or Blue Sky phase of a disaster is to connect with and become a dues-paying member of your local and/or state chapter of voluntary organizations active in disaster, or VOAD. Smaller towns, cities, or counties are likely to refer to this group as a COAD, or community organizations active in disaster, while larger cities, regions, and each state and territory will have a VOAD. Vibrant Emotional Health recommends that all crisis centers join their local, meaning city or county, COAD or VOAD. And for those crisis centers who have a multi-county reach or operate any statewide services, including for the National Suicide Prevention Lifeline, we recommend you also join your state's official VOAD chapter. And note that some states break their chapters into regions, including California and Texas. Also, for some crisis centers that are blended 211 centers, you may already have membership and representation in your local COAD or state VOAD through your center's 211 services. If so, that's great. But remember that the role 211s play throughout the disaster cycle can look very different than the roles crisis centers play. The former being more focused on disaster-specific information and referral, and the latter, behavioral health concerns. So consider designating 2 representatives from your agency for involvement in a COAD or VOAD if this situation applies to you, or simply make sure that any single representatives from your organization are advocating for all of your center's services, including its crisis contact services. To learn more about VOAD and find your state chapter information, visit nvoad.org. And through these state contacts, you can also then get contact information about your city or county's COAD. Also at nvoad.org, you can look up resources that are organized by VOADs for VOADs, such as what are called points of consensus. And there are disaster emotional care points of consensus that apply to your crisis center. And by joining your COAD and or VOAD and attending regular meetings and getting involved in committees and overall just getting active in your chapter, your center will be able to more effectively coordinate with other providers. COAD and VOADs need crisis centers because they need someone and an organization that has expertise in disaster behavioral health, which includes addressing depression, suicide, substance abuse, and other common mental health concerns experienced by the people that these other organizations serve, namely survivors and responders. By getting involved in VOADs and COADs, you'll also be able to help address access and functional needs of vulnerable populations, such as children and the frail elderly, and people with serious and persistent mental illness, people with physical and other disabilities. You'll be able to connect with other CBOs who may serve populations your center otherwise doesn't reach so easily through your own outreach and communications, such as faith-based communities. And finally, by your crisis center getting more actively involved in the VOAD movement, you'll help to continue to diversify the types of organizations involved, which will only serve to strengthen overall disaster preparedness, response, and recovery. Note that Vibrant Emotional Health are also dues-paying members of National VOAD, where we conduct the same kinds of outreach. We attend national VOAD coordination calls and sometimes state calls as well following major disasters, participate in national and regional VOAD conferences and other events, sit on committees including the National VOAD Emotional and Spiritual Care and Disaster Health Committees, and overall advocate for disaster emotional care and promote disaster distress helpline and other local and state crisis support resources throughout the disaster cycle. The U.S. Substance Abuse and Mental Health Services Administration, or SAMHSA, the funder for the Disaster Distress Helpline and National Suicide Prevention Lifeline Networks, and thus the Affected Area Center Initiative, is also a key outreach stakeholder for crisis centers throughout the disaster cycle, primarily in terms of accessing SAMHSA's wealth of disaster behavioral health resources, which crisis centers can then use to inform their work in disaster preparedness, response, and recovery, including sharing these resources with other community-based organizations via VOAD or other forums of engagement. SAMHSA has 3 sets of disaster behavioral health resources of particular interest to crisis centers in their outreach. All of these resources can be accessed by going to samhsa.gov, but direct links for each resource are also included here. First, their Disaster Technical Assistance Center, or DTAC, develops webinars, podcasts, tip sheets, and sends out a quarterly e-newsletter, all with topics of interest on disaster behavioral health. Next, their Disaster Behavioral Health Information Series, accessed via the DTAC website, offers a searchable clearinghouse of research and other best practices in disaster behavioral health, including by disaster type and special population, such as first responders. And finally, SAMHSA's Disaster Behavioral Health Responder app is a free app available for Android, Apple, and BlackBerry phones that allows responders easy access to training resources for when disasters occur, access to their treatment referral locator, etc. While it may not be appropriate for crisis center staff to access such a resource on their personal phones for use at work, since it's outside of your standard referral database, like the other resources mentioned here, it is a great resource to share with the community-based organizations you conduct outreach alongside. Here are a few other key outreach stakeholders for crisis centers to connect with throughout the disaster cycle. Each state and territory has a designated Disaster Mental Health Coordinator, or DMHC, and some states also have a Disaster Substance Abuse Coordinator, either of whom can be key contacts for crisis centers looking to promote your services in disaster-impacted cities, counties, regions, or statewide. These DMHCs are housed within your state's Department of Health or equivalent, and you can find who yours is via the link provided here from the National Association of State Mental Health Program Directors. If your city, region, or state experiences a major disaster event and operationalizes a FEMA-funded crisis counseling program, your state DMHC will also play a key role in administering that program, and so can be a valuable contact as well for crisis centers seeking to explore CCP funding opportunities. And so we encourage you to connect with your state DMHC during blue skies so that you have an established relationship before a major disaster occurs. Ask your state DMHC to keep in touch with disaster behavioral health related events in your region or state, invite them to visit and tour your crisis center, etc. FEMA is divided into 10 regions in the country, which can be viewed via the link provided. Find out what region your crisis center is in, and then connect with your FEMA Voluntary Agency Liaison, or VAL, who can also be identified in the link provided. And VALs are positions that entail exactly what they sound like: dedicated staff from FEMA who work closely with nonprofits and other community-based organizations throughout the disaster cycle. FEMA VALs are invaluable with supporting CBOs such as crisis centers, with networking, coordinating resources, addressing unmet needs, etc., and are usually also closely aligned with all of the state VOADs within their region. Finally, another key outreach stakeholder for which crisis centers should be aware are the Medical Reserve Corps. A program of the U.S. Department of Health and Human Services, the Medical Reserve Corps is a national network of volunteers organized locally to improve the health and safety of their communities. MRC volunteers include medical, mental, behavioral, and public health professionals, as well as other community members without healthcare backgrounds, but who receive training and affiliation through an MRC unit. MRCs engage these volunteers to strengthen public health, improve emergency response capabilities, and build community resiliency. Contact the lead coordinator for your nearest MRC unit during Blue Skies to introduce your crisis center as a disaster behavioral health resource throughout the disaster cycle, and which MRC volunteers can refer to during their deployments when they encounter individuals and families who may be experiencing disaster-related distress or other mental health concerns. Earlier in this webinar, I discussed specific outreach activities which your center can engage in throughout the disaster cycle, and here I want to expand on one of those ideas: participating in conferences and community events. These events can be disaster-focused, such as emergency management conferences or preparedness fairs, or community events that focus on mental health or suicide prevention. For any type of these events, your center can use them as opportunities to boost your center's visibility as a disaster behavioral health resource, as well as the other services your crisis center offers for the community. In addition, if your center conducts regular outreach or has relationships with other community-based programs related to mental health or suicide prevention, such as with schools or youth groups, senior centers, day treatment programs, or clubhouses for people with developmental disabilities, etc., also consider incorporating information about disaster behavioral health into presentations and events you may sponsor with these groups as well. During the short and long-term recovery following disasters, your center should also connect with your FEMA VAL or VOAD chapter to explore opportunities for tabling or other form of supports at disaster-related field-based operations, such as in multi-agency resource centers, disaster recovery centers, family assistance centers, etc. And another creative way to not only boost the visibility of your crisis center during the long-term recovery, but also help your community in its recovery, is to allow staff, when appropriate and possible, to participate in other community-based volunteer opportunities, such as feeding or relief respite services for survivors or responders, muckouts or other cleanup operations being coordinated with affiliated volunteer groups, etc. If you do find such opportunities, if appropriate, also consider having your staff wear t-shirts, caps, or other clothing or accessories that promotes your crisis center. To find out about conferences, fairs, and other community events, disaster-specific operations where outreach opportunities may be present, etc., connect with your local and state disaster preparedness, response, and recovery stakeholders, including all of those mentioned in this section as well as previously in the webinar, via social media, where you can also share services, resources, and events your center has, whether specific to disaster or just general mental health or suicide prevention. Finally, for all of these outreach opportunities, of course it's important to think about exactly what you want to make available to distribute. In addition to brochures or other information you may have to distribute about your crisis center's local services, consider distributing things like disaster distress helpline brochures and wallet cards, including in Spanish, and the company JourneyWorks also has a number of titles relevant to both disaster behavioral health, mental health, and wellness for disaster survivors and responders that you can purchase in bulk and in print with your crisis center's logo. To find out the titles that JourneyWorks has available, see the link provided in this slide. And speaking of logos, don't forget about logo products. For disaster-related or general outreach, consider purchasing items that can also serve a purpose in disaster preparedness, response, and recovery, like flashlight keychains, foam stress relief toys, Band-Aid dispensers, tissue packs, etc. You can get really creative with logo products, and of course, don't forget to imprint your Crisis Center's logo on them when you distribute them at these events. To summarize, here are 5 key outreach takeaways and action steps we want your Crisis Center to engage in throughout the disaster cycle. Number 1. Join your local and/or state COAD or VOAD chapter, become a dues-paying member, and get actively involved by regularly attending meetings and other COAD or VOAD events. Number 2. Via your VOAD and through outreach with the other stakeholders identified in this webinar, form relationships during blue skies. There's a saying in disaster work that no one passes out business cards during a disaster, and so you want all of these key stakeholders to be familiar with your Crisis Center as a trusted behavioral health resource for individuals and families in your community before a disaster affects your community, not after. Number 3. Increase the visibility of your Crisis Center as a resource in disaster behavioral health year-round through promoting your local, regional, and/or statewide crisis support services that are available to disaster survivors and responders at disaster-related or general mental health and suicide prevention conferences and other community events. Number 4. Via VOAD-sponsored disaster coordination calls or meetings before, during, or after major disaster events that occur in your coverage area, promote your Crisis Center as a disaster emotional care resource that's available to survivors and responders, as well as available to other groups with unique access and functional needs that your Crisis Center can address, such as to non-English speakers, people with limited mobility who may not be able to access brick and mortar services in a disaster, to people with pre-existing mental health concerns that have been triggered or aggravated by a disaster event, to people who are deaf and hard of hearing, etc. Disaster stakeholders need to be reminded of crisis services, especially in an active disaster response, as there are many resources being shared in that time, and so participate in these coordination calls to further boost the visibility of your Crisis Center as a resource available to your community. And finally, stay involved in your affected area during its long-term recovery, whether that's months or even years, because one of the unique aspects of crisis centers is that we're always available, even as some disaster-related services understandably phase down their operations during long-term recovery. So it's important for your center to keep promoting your crisis support resources to those who may still experience struggles during long-term recovery. Thanks for participating in this webinar on disaster outreach for crisis contact centers as a part of the Disaster Distress Helpline Affected Area Center Training and Technical Assistance Initiative. If you have any questions, would like additional resources, or have any other concerns related to disaster outreach in your community, don't hesitate to reach out. I can be reached at cburgess@vibrant.org, by phone at 212-614-6346, or connect with me on Twitter, where my handle is cburgessddh.